Hi, everybody. Welcome to this recording of a discussion between three psychiatric pharmacists. I'm Violaine Masson. I'm from Montreal. I work in the Mental Health University Institute of l'Université de Montréal, and as well as l'Hôpital Maisonneuve-Rosemont, and I'm a board-certified pharmacist, and I'll be the host. And I would like to introduce two fellow pharmacists. First, there's Seth Gomez. Seth, can you introduce yourself?
I'm Seth Gomez. I am a psychiatric pharmacist based out of Alameda County, which is located in California in the US. And I have been working as a psychiatric pharmacist for about 7 years now.
Thank you. And we also have Marcel Laporte. Marcel, can you introduce yourself?
Absolutely. It's Marcel Laporte coming from downtown Sarnia in Ontario, Canada. I'm a pharmacist that specializes in addiction medicine, and I've been doing so for quite some time. Thanks.
Thank you. So today we'll speak about how COVID has impacted our practice. First, let's start with Seth. Can you explain us what's the COVID situation in your country or in your area?
Yeah, so in the US, there's been at least or over 2.6 million positive cases, confirmed positive cases, and over 125,000 deaths reported in the country, which estimates to be about 1/4 of the global infections and deaths, and it's quite alarming. In California, we have recently have been seeing an increase in infections, also mirroring other states in the US. And I recently learned a fun fact, in that California, among Texas and Florida, make up about 1/5 of the world's new infections in the last couple of weeks. So quite alarming. We have certainly seen a disproportionate rate of infections and severely ill people who get infected with the virus coming from nursing homes or other congregate nursing or health-like settings, and also seeing a disproportionate amount of folks in the Latinx community and other minority groups, including African American and Black communities. So certainly something that's quite alarming. More locally here in Alameda County, we have certainly had our own surge of positive cases. We have several hundred positive confirmed cases and about 125 or so deaths related to COVID locally. Another interesting fun fact I was learning about is that in the state of California, they have a metric that evaluates the risk of exponential spread of the virus in our communities and throughout the state. And that metric showed that for every one person who is infected with the virus, they are likely to spread it to one other person. And that specific metric was rated at 1.09. Anything above 1 means there's exponential growth. And what was interesting to me is that here in Alameda County, we had that our estimated spread factor, is what I'll call it, is about the same. So we, in Alameda County, our state of California and across the US are seeing various alarming infections, the rate of infections, and also people succumbing to the illness throughout.
Thank you. And what about you, Marcel? What is the situation in your area about the COVID?
So COVID is obviously a great concern. However, we've seen a very different picture here. In Lambton County, which is where Sarnia is located, we've had 2 infections in the last 4 weeks.
Wow.
So in terms of actual numbers, obviously we're at a very different spot on that curve. Albeit early on in this pandemic, Sarnia has succumbed to a fair number of cases, most of which pertained to a particular funeral where a bunch of people came back from holidays in Portugal and attended a funeral, and about 50 or so were infected all at once, of which 15 or so passed away. But then since then, obviously, we followed pretty much what was be expected around us. We were never really in dire straits in terms of our ICU or otherwise. Like at most, we were at half capacity. And there was a field hospital that was set up in the event that it were to be an issue, but it was never used. So very different circumstance here. Obviously, a lot of precautions were taken. The border community with Port Huron, Michigan, and obviously the border was closed very early. So many different steps were taken that were very proactive and very very strictly adhered to. I would say that, given the circumstance that occurred very early in this infection, I was taken very seriously, and there was very little resistance to what was being suggested by public health. So very fortunate to be in the circumstance that we are today, and a lot of that has to do with the strict adherence that the residents on during this.
Thank you, Marcel. So for us, my hospital was one of the hospitals where we received COVID patients, and we got to a point where it was really full and really stressful. And the situation in Montreal is much better now, but we had a lot of deaths in the nursing homes. Many foreign workers stopped working in nursing homes because they were afraid of getting the virus, and a lot of old people died of it. It's really a tragedy. But for the rest, the lockdown really helped flattening the curve. As per Google, apparently the Montrealers were the one who were listening the most to the lockdown, the period of the lockdown. So, but now we're seeing a little surge of new cases because it's summer and it's nice and bars reopen. But apparently it's private encounters of people, not bars, that are responsible for the majority of new cases, and people like us, healthcare workers. So, what does a day in your professional life look now with COVID, and what's different than before? Let's start with Seth again.
Yeah. So pre-COVID, a lot of my work was providing clinical pharmacy services related to psychiatry and addiction medicine, and supporting medication management services for clients, and also providing consultative services for providers throughout our network. My particular clinic focuses on care provided to people experiencing homelessness, and since the COVID has really changed the course of how everyone delivers care, a lot of our services, mine and my colleagues, have quickly adapted to provide telehealth with video audio capacity, and sometimes with just audio, to check in with our clients and to make sure that they are receiving the support that they need. Also in this post-COVID environment, the current COVID environment, some of my work has been repurposed to support my local jurisdiction, our county's COVID response for the entire county. And specifically for people experiencing homelessness, we stood up hotels that are to provide shelter for people who are infected or presumed infected with coronavirus, and also sheltering people who are most at risk for having very severe complications from the illness. And so we have two different types of hotels that have been set up, and my role has now been to support clients who are sheltered in those environments and support the coordination of pharmacy services in general, and providing some clinical services around psychiatry and addiction medicine as much as possible.
Wow, interesting. My work hasn't changed that much because I'm working in inpatient unit. It's just the units have been redesigned so that some units are cold, some are warm, and some are hot, if I might say. So that's been the biggest difference. And in the weeks before the COVID hit us, it was well, not empty, but let's say half empty. It was something that I've never seen. But all our hotels that we used to shelter people, they've been closed now because we didn't need them. We didn't have that many cases now. And what about you, Marcel? What your day look like, and how is it different with the COVID-19?
So obviously, very early on, a lot of precautions were put in place. The environment that I work in is a fairly high volume, high paced addiction medicine practice. 5 physicians, a handful of counselors. So we really rolled through a lot of patients. Given the situation, that change was fairly dramatic in the sense that limiting numbers in terms of patients that are in the waiting areas. The physicians themselves changed their practice in the sense that they were issuing longer prescriptions, so to speak, seeing the patients less frequently, and always in an environment that had more barriers. The pharmacy itself had some plexiglass installed. Obviously, PPE was something that was used very seldom in the environment up until COVID, and obviously that changed. Everybody was masked and gloves and whatnot. And then it's just the way in which we interacted with the patients changed as well, simply because it's when you see someone on a daily or weekly or biweekly basis, there tends to be a little more involvement in terms of what's going on day to day, and everybody's circumstance changed so dramatically that many of those conversations were being had, but they were somewhat strained as a result of all the barriers that were in place. The pharmacy itself, in terms of the services that we provide, were fairly consistent with what you would see, pre and post COVID. Obviously, the way in which we were delivering them was different. Obviously, telehealth was a big part of that, and then we often were seeing patients who may or may not have been exposed required special delivery of their doses and whatnot. And again, we utilized telehealth to visualize the ingestion of the doses, and if there was any counseling and whatnot that to be had, that was obviously the way in which it was done. So in comparison, in terms of pre and post, I think a lot was learned in that, and I think if anything, the communication within the team itself was obviously honed and had to be a lot more straightforward, just to make sure that we're getting some of the information across. So I would say what the difference was.
Thank you, Marcel. And how has the community adapted to COVID in your area?
I think it, initially it was, everybody was somewhat taken aback in terms of the severity of the measures that were put in place, in the shelter in place orders, the closing of the border. It's a very serious thing when you start seeing, hockey leagues canceled and whatnot at that time of the year. But that was a big deal, and a lot of the patients expressed, the seriousness of it. Obviously, never having experienced anything like that. So that was probably the initial was a little bit of a shock. However, as time went on and the measures continued to be in place and things got a little more strict in terms of social distancing, and even to the point where it was really encouraged that people not go out of the house, and that any of the trips that they were making were strictly for essential services. So obviously, attending the pharmacy or otherwise. There's a little bit of anxiety and concern that started to rear its head, and obviously for some of them it was a situation where part of their issue is that they isolated on their own as a result of the addictions that they had, and the situation that they were presented with is that they were forced right back into that. So we saw a lot of relapsing. We saw a lot of them sort of digressing in terms of their stability. And then obviously, this has been going on for quite some time, and it's for us, it's becoming less intense. Obviously, the phased in, the phasing in of laxing of the restrictions has made a big difference in terms of people being able to go out and sit on patios, and in the near future we're talking about opening restaurants in the seated areas as well. So that's helped a little bit, but you know, I think it was a very stressful situation. It's still a stressful environment, and given the situation with most of our patients having some kind of concurrent mental health issue, you know, it really taxed them in a way that I don't think many were expecting. You know, as this wore on, it was very obvious just in the day-to-day conversations that we were having and the situations that were coming up in terms of the desperation that a lot of them were showing.
And about you, Seth, anything different on how your community has adapted, or pretty much the same?
Yeah, a lot of it is the same. I think we can echo a lot of that here. What's interesting that I think it might be helpful to point out is in the U.S., people, the micro communities, micro climates throughout the country may have reacted or responded differently. While some have early on or maybe shocked by the shelter-in-place mandates and reacting to that, responding to that, some accepted that and embraced that, and in other parts of the country maybe didn't meet with that same level of acceptance. And so I think that, yeah, there were some variability there, but by and large, it was pretty much the same.
Okay, so Marcel, we discussed already some steps that your pharmacy took to mitigate the risk. Any other steps that your pharmacy or your clinic took to manage patient safety or manage drug shortages or PPE shortages?
So all of that.
Yeah.
We obviously took some measures in terms of staffing to try and mitigate the risk of having you know, the whole staff come down with COVID, and obviously that would dramatically impact the services. So both the physician team and the pharmacy team formed two separate staff, so to speak, that did not overlap in any way. So what that did is ensure that if there were to be an issue where someone were contracted or be exposed, that in essence, we wouldn't all have to be isolated and whatnot. And if someone were to become sick, obviously there's a lot of redundancy in that. So that was sort of a big deal initially, setting that up. And then you talk a little bit about PPE. Well, you know, initially it wasn't a big deal. We all had gloves, we had some masks, but when it sort of drew out as long as it did, we really weren't equipped in the sense of even at the supplier level being able to access these things. So we were sort of taxing a lot of them to try and provide us with just the bare basics. And obviously over time, it was a bit better. Like today, it's not such a struggle to get those things. But initially it was very much so. And well, it was a difficult part for the staff, especially because we're not used to wearing it in the first place. And now it's the expectation is that we're, you know, doing everything we can to protect ourselves. And the sheer basics of what that is, we can't get. So that was a little bit of a learning curve. In terms of the way pharmacy was sort of being handled to try and manage the supply chain issues that we had, I think across the board, everyone adopted a 30-day maximum supply on all their medications, which obviously helped with sort of ensuring that everyone had access. However, the problem with that is it's you know, put a lot of stress on the pharmacy itself, because now we're filling many of these medications multiple times a month as opposed to just once. So that was a learning curve as well. And even in the midst of that, there was still a lot of management that had to happen in terms of ensuring that we were providing each of the patients with the medications they're expecting. So yeah, definitely.
Yeah, that's oh, sorry, go ahead. Yeah.
A big learning curve.
Yeah, that's interesting because we got the same in my province. My husband told me at the end of January, he's a mathematician, it has nothing to do with health. He said, go to the pharmacy and fill your prescription for as long as you can. I was like, that's the worst thing. If everybody do this, we're going to have a lot of shortages. So if you have a individualistic view, you take as much as you can, but if you think more globally, then the reasonable thing is to, get only 30 days at a time. But then, of course, for the pharmacist, then it makes us work more. But I don't know if I think I preferred that than to manage shortages and having to call and having to decide which patient gets what. Because for us, one of the steps was there was a national prescription for everybody on hydroxychloroquine who was stopped for like 3 months, except I guess pregnant women or people younger than 18 years old. So it was really hard to explain for some patient that they could, their rheumatoid arthritis was gonna be okay for 2 months without their drugs. So that caused the problem. And in my hospital with COVID patient, we were like really near not having enough medication for sedation. So we used like oral medication on top of IV medication to kind of use less IV medication. It was really, really strange to, accept those prescriptions, fill those prescriptions, but then or using barbiturates or older drugs that we're not using now because we have better drugs, because otherwise we wouldn't have enough for every patient. So we did well. I mean, at the end it was okay. And now we're having a shortage of dexamethasone. But we have other strains of dexamethasone. We have like 2 milligrams. So we're switching the 4 milligrams to the 2 milligrams. And then I guess in 2 weeks we're gonna be out of 2 milligrams. It's like a domino. So, and the same for us for the PPE. We didn't have like a shortage, but we didn't have enough N95, I guess. So a lot of people were told just to wear a surgical mask, which were not enough for some healthcare workers who got infected. But I guess for the floors that are with patient with COVID-19, then you have someone who's checking you when you get inside of that floor, who's telling you need to wash your hand after your gloves, before you put whatever. It's really, I mean, even me, I used to work sometimes with tuberculosis patient, and it's really tiring to work with a mask for 12 hours and to have this person looking at you, and you always forget to wash or to touch whatever. So it's hard, but most of my time I'm not with a COVID-19 patient. So how has your practice been impacted differently than I guess general practitioner? Do you have was it impacted differently, Marcel?
I would say that it was different in the sense that most of the GPs around here, for lack of better terms, closed their practices and were strictly seeing patients via telehealth. Which in a lot of cases that was the obvious safest thing to do. However, for us, we're so much more hands-on, and the patients interact with us so much more frequently, and sort of, if we were to turn that off entirely, I think that the chaos that would have created would have been probably equally damaging to the exposure that they could have had. So it was more of in all honesty, an opportunity for us to take the time to speak with them and give them a more balanced idea of what was going on around them, reassuring them that all of these measures are being done for their best interests at heart, that it wasn't a matter of alienating them from us, that we were just as much a risk to them as they were to us in turn. And just giving them the confidence that, despite the fact that all these things are so unstable around them, that, coming to the clinic and speaking with us and seeing us really could be something that they could sort of, not necessarily like ground themselves in, but they knew that it was an environment that they were safe, that the information that they were being provided was going to be solid, and that it wasn't an area where They needed to be overly concerned about all the other things that were happening, right? Getting their groceries and all the other stuff, that's still going to have to happen, and albeit different, and having to, to distance from everyone around them. That here it was, we did everything we could to ensure that there was some consistency in terms of what they were going to expect, in ensuring that we absolutely delivered that. The staff themselves understood that and embraced it. So sometimes it's a matter of, putting aside where you're at and just, bringing the smile and giving them something that could be a positive. And, I think everyone, myself included, at some point in this struggled a little bit with all the isolation and everything else. And I think it very quickly brought it around in terms of, this is what our patients are dealing with, day in and day out. And a lot of them, were anxious and whatnot before any of this happened. And obviously this didn't help. So really, to me, it gave us a little bit more of an appreciation of how important it is to have those interactions. And, the simple conversations are not just simple. And they do make a difference. And it's even more important than that to do it.
Yes, yes, I agree. And about you, Seth, I don't know if you have any other things that your pharmacy took to help patient. We talked already about the telepharmacy, telepsychiatry, maybe switch to injections, or were there any other steps that you took to protect patients and workers?
Yeah, we try to really reevaluate the medication regimens of our clients and thinking about which ones could we switch to an injectable medication. We found that actually might be a better approach for some of our clients because we didn't want them to have as many frequent interactions at the pharmacy level. At the same time, we really are trying to take advantage of the fact that our pharmacy systems are really pushing and making available mail order delivery of medications, which I think is a big, it's one of the key things to help decrease the interactions that could potentially spread the virus. And so for us, we certainly have tried to switch over to getting people on injectable medications where appropriate. And also, as previously stated, increasing the day supply that we wanted the clients to have dispensed, assuming it was safe for those clients. Not to take the conversation backwards, but I also wanted to highlight that early on with the emergency provisions or declaration of the state of emergency for the pandemic, there were a lot of policy changes around insurance companies' willingness to pay for medications beyond a 30-day supply or whatever their restrictions were. And so some of our providers are taking advantage of that to help mitigate some of the anxiety and stress that comes along with folks being out in the community for essential services that could be minimized by less frequent dispensing encounters or getting injectable medications.
Thank you. So I agree that less frequent meetings with anyone is better for the spread of the virus, but then it can increase anxiety and it's hard for some of our patients. So
it is a balance.
Maybe Seth, what are some strategies that you've used to reduce anxiety of patients related to COVID-19?
Yeah, and I think the $1 million answer on how to best do that is still out there to be determined. But one of the things that we have done is we still encourage frequent contact even when somebody doesn't require a specific medication refill. We certainly want to increase the contact, especially for our most vulnerable patients and people who are at higher risk of destabilizing from their conditions. And take those opportunities on this contact to see if we need to make any dosing medication changes that might better serve the client. At this time, it's also important for us to recognize that having anxiety during this time is something that's felt collectively among the community. It's community anxiety in addition to individual anxiety, and reminding folks that we can, if we can find ways to repurpose that anxiety, that energy, into a healthy way, whether that is reminding folks about engaging in a new task, something that they were interested in doing already, but just maybe haven't had the opportunity to, using this time to really tap into those interests, or also repurposing this energy and feelings of anxiety to help promote better health and adherence to shelter-in-place measures to protect the entire community and not just themselves. Reminding folks about mindfulness training and obtaining exercise are certainly other strategies that we are invoking to help relieve the distress that this is causing to clients overall.
And what about you, Marcel? Do you have other strategies that you've used to reduce anxiety of patient related to the situation?
In all honesty, it's not that different in terms of what's already been said. There's a number of circumstances in which patients come in and they're very much destabilized in terms of where they're at, and so how we handle that doesn't change all that much, despite the fact we're in the middle of COVID. But that being said, I think that everyone just had an extra dose of compassion when it comes to seeing how all these things were transpiring, and just a greater understanding of the person that's standing in front of you.
Yeah, some of the things that I'm struggling with, because I work in inpatient, so I get more refractory or like people who have schizophrenia or other diseases. Sometimes when we find a stressor in their life and they relapse, we just do a little tweaking in their medication and we don't change it, and we which like do therapy and psychotherapy and hope for the best. But now sometimes I'm wondering, or the situation is so long and the patient is not feeling well, then I'm like, should we change the medication or not? Because it's not gonna go away soon. So then I'm like starting drugs like clozapine, which I know, as opposed to being on an injectable, clozapine is gonna increase their visits to the healthcare center. So it's one of the struggles that I have, and it depends on who in the team. Some nurses are like, the patient is really not going well, we should do something. And then sometimes I'm like, yeah, but then we're all struggling. So I can understand why the patient is struggling, and maybe a change of medication is not the answer. But then how do you cope with a situation like that? It's going to last for months. It's really hard.
Yeah, and can I add one piece?
Yeah.
I think that what I've learned over the last couple of months here is a lot of the distressing calls that I get from clients and people in the community. The root of their stress anxiety, of course, related to coronavirus, but also because they are reading information on platforms that might be perpetuating misinformation, and that increasing a lot of the paranoia, anxiety, and fears that we are seeing and observing. And so, one of the things I especially with clients that I work with regularly, invite them to challenge themselves to limit their sources of information to, our local public health department, or limiting how often that they are reading these, various news streams where information might be conflicting and confusing. It's even confusing for healthcare professionals sometimes. Yeah. And so I think helping folks, redirecting them to appropriate sources of information, and limiting their contact with places that might be doing more harm than good, are some of the conversations I've had for some of these clients.
Yeah, and I think that applies to healthcare workers as well, to decrease the amount of time we spend on media. Marcel, do you have other strategies for healthcare workers to help them cope with the anxiety related to COVID?
Well, the environment that we work in day in, day out, obviously we're different in the sense that we have each other a little bit to lean on, and it's not as if we're immune to everything that's going on around us. And just like anything else, it's being able to reach out to the people that we trust, and the people that often those are people that we work around. and just sharing and giving each other the encouragement to sort of continue on and keep doing what we're doing. Obviously, the community recognized many times, how important the services that we provide are, but that means that we need to be healthy in the sense as well, right? So, doing the things that we do, whether it be going for a run, to clear your head, or a lot of people relied on going out to the gym, and that was all closed, right? So, just doing your best to sort of maintain your level of fitness, and that's that hones your mental acuity and everything else, and just doing what you can, where you can, and however you can. So for some of us that meant working out in our houses or whatnot, and that's important because it all sort of intertwines, and we all know that. So it's just a matter of reassuring and sort of seeing the trees for the clouds, and just that was really the approach that we took. And it was hard, especially splitting the teams, because we're used to having the 10 people crossing paths on a daily basis, and literally there's some of them that we hadn't seen in weeks, which is odd. We all go home to our same families, but we often spend more time with the people that we work with, and having them separated and not seeing them was a challenge in and of itself. So things that you wouldn't necessarily think of at the outset became a bigger deal as this went along, for sure.
Yeah, I think we're still in a way lucky to work. I mean, we're exposed to coronavirus, but not as much as some other workers, and it's gives you a sense of you have a purpose, you have a role to do, you're useful, and then it gives you a routine as well as something to rely on your colleagues and everything. So I think we're in a way lucky to work, even though it's hard, and it changes every day. There's still a little bit of routine, I don't know, for me. So we're moving to a couple of last questions. So were there any challenges that are specific to your country, that happened during the coronavirus?
I think the biggest challenge was kind of talked about earlier about managing shortages in general, whether that's PPE, testing supplies, or drug shortages that were raised. I think we share a lot of that. The other thing that I'm concerned about is how this coronavirus pandemic is setting ourselves up for future crises. One of the things that we are seeing, at least locally, is that this is revealing a lot more housing insecurity issues, food insecurity issues, occupational security issues. People are really stressed, not just about the virus and getting infected, but also about maintaining employment, having enough, finances to hold their have a place to live, to put food on the table, those types of things. And so, although those are not the peak of all the crises that we are dealing with, it's something that we are observing and thinking about as another future challenge that this pandemic is going to reveal.
And what about you, Marcel? Any challenge specific to your place?
I don't know that there's anything specific to Sarnia in and of itself that's different than everywhere else. I do think that part of the anxiety and everything that went along with this caused many people to be reluctant to seek proper care in situations that they would otherwise have made their way to the hospital immediately. I think there was a number of situations where people were having heart attacks or strokes and whatnot that there wouldn't even be a question as to whether they would access emergency services. And just that slight delay in care, rethinking whether it's worth going to the hospital, that had some very detrimental impact on many people that, although not COVID related in the sense that the virus caused it, but absolutely COVID caused as a result of their reluctance to go to the hospital. And so much so, in our community itself, the CEO of the hospital actually said that our emerge is here and we're ready to help, and we're we're open. There's no need to be weary of coming to the hospital. If anything, it's a safe environment. And the fact that that message had to go out there is really a testament to the level of concern that people had with regards to what this virus meant. So that to me is probably one of the bigger things here, because that you're talking about healthy people who are not, well, obviously not that healthy if they needed to go to emerge, but nonetheless, not related to COVID, that were reluctant to seek medical attention as a result of it. So,
also saw that here, decrease in utilization of appropriate use of the emergency department for a long period of time, and also a decrease in the use of EMS services in general. So it's, messaging that it's okay to seek medical attention when you need it. It's an important message that I think we have to constantly remind ourselves to get out there.
Thank you. So maybe my final question is, do you have any key messages you would like to tell patients or co-workers or healthcare workers in other countries? Maybe Seth, do you have any key messages?
I would say that, all of our roles are really important. There are multiple lanes of responsibility that we have as a community, as people, as healthcare professionals, that are going to play a role in curtailing this virus and improve the safety of our community. But that, this coronavirus is not the only crisis that we might be experiencing locally here. It's an opioid crisis, it's a housing crisis, it's, coronavirus, right? There's so many, and these all might intersect in a way in our patients, in our clinics, in our work. And so reminding ourselves that through the work that we're doing, that, there's not to put the pressure on ourselves to be the heroes, but to also recognize and balance that with, that intersection of multiple crises and how our work can help address multiple.
Thank you. And you, Marcel, do you have key messages to send?
Well, I think, much of what was already said applies here just as much as anything. And I think that, the role that we play in terms of bridging the gaps to a certain extent in the various areas of information, I think is a really big deal. We're very much trusted, and sort of helping to dispel some of the issues that sort of came up in the midst of all this, and just reassuring patients and otherwise of all the great blessings and benefits that we see as a result of the healthcare that we have, and the trust that's been afforded us in terms of providing that. And as you mentioned, the other issues in terms of opioid addiction and overdose and everything else that have really come to the forefront in this area with the desperation in this population, and just being able to recognize that for what it is, and to really look to even to our leaders to try and address some of that, because this isn't just the result of COVID. There's a lot more happening, and there's just like a duck, there's a lot going on under the surface, and we really need to dig down once a lot of this has settled down, and seek to address some of those issues, and housing and finances and everything really do intertwine with that. But there's a lot to have been learned as a result of this, and I think we'd be sort of missing it if we didn't take the chance to learn from that.
Thank you. My final message is not from me, but it's something that I thought was really interesting to know. The former president of Doctors Without Borders is a Montrealer, and she fought Ebola virus, and she said that one thing that they struggled a lot was that the local population was really angry at them for not burying their deaths the way they were doing it before. So I think it's really hard for people who are mourning now, because it's not a typical not a typical time. You don't have like all your coping mechanism. So, and I think one of the things that really affects healthcare workers or people when there's somebody who dies is if you feel guilt. Because if you feel that it's your fault or that you could have done something and you could prevent it, that's really that paves the road to depression or problems. So if you feel guilt or if you feel bad for whatever reason in those days, it's like normal. We're all struggling to a certain level, and it's okay to seek help, whatever the help you wanna have. So that's it for us. Anyone wants to add something else that we didn't address or no?
Thank you for giving us this opportunity to discuss this. I think it's really important to recognize the work that we're all involved in and recognize our community and what they're going through.
Thank you very much. We're all in the same situation. Even if it's different, we're all in the same together globally, but and we'll get out eventually of this. So thank you, Marcel. Thank you, Seth. And thank you, Pharmacists Without Borders Canada, for giving us this opportunity. Thank you.